I'm Melissa Burrows, Director of Talent Acquisition, Workforce Diversity at the Cleveland Clinic here in Cleveland, Ohio. And I wanted to talk a little bit about how we have racial equity, inclusion, etc., all based on workforce diversity here at the Cleveland Clinic. The first thing I want to do is talk a little bit about the work that we're doing here in Cleveland and how it really represents local hiring. But from the perspective of the actual Cleveland, Ohio, think of this in terms of Broward County, where you are. What does local hiring really mean? In Cleveland, local hiring really means it's really based on the community that we serve. And in this instance, we really are trying to find individuals that reside within the city of Cleveland. What we have done, and specifically this year, is we've sort of expanded that definition around where we actually have facilities. Because think about that, from a local hiring perspective, wherever we have facilities, if individuals, if the workforce can walk to work and transition very quickly from home to work, then we're more likely to have individuals who, one, will be happy, two, we'll be able to hopefully retain them longer, and C, they will be the ones to actually be able to see the residents and their populations that they already know. And so from a 2023 objective key result, I have a couple of things that I'd like to tell you. One, when I talk about local hiring from the city of Cleveland here in Ohio, it really is this year, the objective key result or goal is to hire 1,450 City of Cleveland residents. And I will tell you the way that we're able to do that is really by partnering with community organizations and local officials, specifically council members from the city of Cleveland. We have been able to find success based on our ability to go out into the community, as opposed to us inviting individuals in, which we absolutely do. The trusted advisors in the community are our local organizations. So for instance, a resident would be happier to go out into their own community development corporation because they already have a network, already have a rapport, already have a connection to that community development corporation. And then afterwards, they are able to partner with those community organizations as it relates to jobs and all types of services. And I'm sort of weaving this thread as I move into this social determinants of health, but then I always also want to take us down this path of social determinants of work. And so think about it from the community perspective. I'm comfortable with going to that community development corporation. I've already been there several times. I already know the individuals and the staff that work there. So I'm more likely to go to that organization than I am to go inside the Cleveland Clinic. And we found that by partnering with organizations and sitting in those organizations, then we become part of that social fabric and network of the organization. And our goal really is to make and create this welcoming environment within the community organizations, and then taking that piece of it once we interview on the spot in those organizations. Once we are part of the fabric of that organization, then we're able to actually hire within that organization, almost literally. So we go out into the community and partner with them. So it is really around local hiring. It also then is part of this 110 initiative, and I'll just briefly touch on 110. So 110 is a coalition of organizations throughout the country, and the focus of 110 is really to hire, advance, and promote 10,000, 100,000, I think that's the number. I keep getting that number wrong. Black talented individuals over the next 10 years in family life sustaining wage positions. And I'll definitely will include that number in the deck, the PowerPoint deck. But I will tell you that the piece around that is thinking of it from a skills first perspective. So specifically, instead of you having to potentially have that degree requirement, the job descriptions are being rewritten based on a skills first approach. And when I think about that perspective, I always use myself as the example. And although I have the PhD, a lot of what I learned was on the job. And so having that experience, job experience, is really what can set you on the path of success. And so organizations are starting to realize that, especially through the 110 initiative, and they are able to then rewrite potentially their job descriptions so that we're creating opportunities for success. And then most importantly, opportunities for individuals and populations to enter into the workforce in areas that they might not otherwise have been sort of invited into. So that's another component as we talk about care for every community we serve. And then again, we're in this space where we're also building talent pipelines, and those pipelines really have to do with apprenticeship programs and then the community engagement, sort of the information that I spoke before. But I'd like to sort of move specifically around this piece around how we have and think about social determinants of health. So we've heard that term a lot. And most recently, probably about a month ago, I just learned about the term social determinants of work. So, what are those items or barriers that individuals need so that they can advance within the workplace? And part of what we're learning is that individuals need assistance. We all do, right? But most importantly, how are we as a workforce, as an organization, how are we going to be the ones to help and most importantly, identify from our communities what those social determinants of work are. And I'm not going to take any credit for that term. That term is really from Dr. Angela Jackson from Harvard University. And I was very fortunate enough to hear her speak about this at the City Club of Cleveland last month. So some of the things I'd like to talk a little bit about that in terms of the social determinants of work. What are some of the barriers that are preventing individuals from being successful at work? The first one that she really talks about is around job flexibility, the ability to be able to change your work schedule or adjust your work schedule based on it could be based on your life circumstances. And let me give you the example. If I am a member of the sandwich generation, and we kind of know what that is, right? You have elderly parents on one side of you, but you also have little people, I call them, or your children or someone in your family, little people that you're raising. You're in the middle of that, and you're having to take care of both your little folks and your parents. You may need that job flexibility because you may wake up tomorrow morning and say, uh-oh, my elderly parent who lives with me is sick. I can't go in at 8 a.m. I may need to start my workday today at 10 a.m. Depending on the type of role that you have and where you are sort of in this socioeconomic class, and I'm saying that in terms of where you are in this hierarchy of work, the work structure, you may not have that flexibility of being able to determine that you want to come in at 10. And it's not that you want to, it's life circumstances are preventing you from being able to show up at 8 a.m. And in healthcare administration, where I reside, and not even just the administration part, but this healthcare, we're on shifts. And so it makes it difficult for individuals, especially if they are in those gateway entry-level positions, to be able to change their schedules based on what's happening in their life. So one of the social determinants of work and the ability to be able to thrive in the workspace, part of that is that job flexibility or not having that. A second one, as I sort of noted when I talked about the elderly, our parents that I was referring to, and then also our children. Same kind of situation. I may begin my workday and want to begin my workday and have to begin my workday at 6 a.m. But unfortunately, I may wake up and I may notice that my child has a fever. If I have to take various means of transportation, and I say that meaning several buses to work, it's going to be difficult for me to really get the help that I need, especially if I am only relying on myself or maybe even one other individual. Maybe I'm relying on my sister to help me with childcare, and she can't help me today because she had to go into work. And so, not having that flexibility because based on your childcare situation, or I will say to you, not having you almost have to have the backup to the backup to the backup, right? So it's that pre-planning. If my child is sick and my child has to stay home, what am I going to do? That is another social determinant of work that will derail your career trajectory, not being able to have steady and reliable childcare. Third point that Dr. Jackson speaks about is really around healthcare. I may be in, again, I'm going to say this gateway entry level position, and I don't have the ability and don't really have all the healthcare that I need. Almost, if you think about it, I'm sort of healthcare poor, right? I am not able to really have this reliable healthcare that I can actually use to the point that I can get well again. And I really want, I'm not quite sure the extent that Dr. Jackson speaks about this, but from a healthcare perspective, and I'm going to say this, especially within our people of color, and most importantly, and I shouldn't say most importantly, but within our African American community, we also have to think of healthcare from a physical and a mental well-being. And so healthcare is a really important component, and we have to think about both aspects related to that. Transportation. We know that that's a big barrier. If I don't have reliable and dependent transportation, that's an issue, right? I may start out to work and my car breaks down. That means, what do I do? Do I call my shift manager? Do I call I'll go back to my sister maybe and ask for help. But by this time, I've gone through a couple of different scenarios related to my car breaking down, and I'm stuck at this point. I don't potentially have the money to get the car fixed or get the car towed, and I've lost a whole day of work. Not to mention the ramifications if it's to the point where, because I didn't show up that day, then it starts the ripple effect. Maybe I get a point, I'm on a point system, or maybe I just don't even, maybe I lose my job potentially, the worst case scenario. The other piece about transportation is and reliable transportation. But if you're not the one driving the car or the vehicle, then I may be relying on public transportation to take me from point A to point B. But keep in mind that I may need to take 2 or 3 buses to get to my final destination, especially if I'm not within walking distance of where I work. And so that creates another ripple effect. Another point is really that sustained education. I may have started my career, and most importantly, my education. It's completed my high school diploma or GED, but really, if it comes to the point where I want to advance within my career, I need some other additional certification or some type of additional education. And sometimes, as we know, we just talked about barriers and social determinants of work prior to this point. All of those items, job flexibility, childcare, healthcare, transportation, even all of those to this point may have an impact on whether or not I'm able to sustain my education and advance within my career if that's required. Home and community health. Just think about the support systems that we have related to home and community health. Being able to really use and utilize those resources and being able to understand where they are so that we can advance within our career and just sustain where we are is an important component. We talk about this in Cleveland a lot. We've made strides on it, but think about it from an internet broadband access IT perspective. There are times when, and I say this, I have a 27-year-old niece. I say this to her, and I'm guilty of it too. There are times when I can use my phone for some things to get the work done. And luckily, I have access, right, to the internet from my phone. But there are other times when I really need a computer. I need to be able to connect to the internet from a desktop, laptop. Um, but if depending on your situation, if that access is not available, or you have to drive or go to another location, so for instance, the public library, maybe it's 3 a.m. Maybe you just got off of work and now it's 3 a.m. and you have no access to the internet, but you know that you need to check, let's just say you need to check the bus schedule. What do you do? It's 3 a.m. There are difficulties by not having free, let me emphasize that, free access to the internet, to broadband technology, so that you can advance. If you don't have access to that resource, what do you do? Again, you can use the library, but you have to get to the library, and it just depends on the timing of that as well. That can be another hindrance, and most importantly, a social determinant of work. And then finally, the last component that Dr. Jackson speaks about is really access to justice, right? We are in a society in which the restrictions are becoming even more difficult. And I always think about my mother's time. My mother will be 85 first week in May. And sometimes she says to me, it almost seems as though the times are worse now than they were when I was your age. And so I really think about that and think about the impact, especially for those individuals who may be justice involved. How do we allow them the ability to become whole again? And when I say that, when I say whole again, I really am speaking about their ability to to have access to a lot of the resources that we take for granted. And one of those resources is their ability to potentially work. And so we as a society, and I will just say, especially we as people of color, need to think about what laws are in place. How can we advance those laws so that we don't stigmatize individuals who are or have been involved, justice involved, that we don't stigmatize them for the rest of their lives. They too should have the ability to succeed and advance within their careers as well. And without that ability, here we go with that recidivism, right? And so it's up to us to really try and think about all of these aspects related to social determinants of work. And then, as we have spoken about before, those social determinants of health. Because if you think about it, they're sort of one and the same. When one of those components is out of whack, the other one it's just a ripple effect. It has a ripple effect on your life, and then not just for you, for the ones who are around you, your loved ones, and ultimately for society. But everyone deserves an opportunity to be able to succeed, and part of that is that they are able to be successful based on these social determinants of work. And so I've been able to hopefully just provide a little bit of an overview of some of these items. And you know that these items are much bigger than us. And so we collectively have to work together so that we can solve, improve, figure it out, right? Because we owe it not just to ourselves, but we really owe it to society and those individuals who are impacted. And I always say, I'm not proselytizing, because I know that that's not what we're here for. But I always say, there by the grace of God go I. I could be the one standing there waiting for the bus with 3 kids, or whatever picture you want to think of. But that could be me. And so it really is up to us as a society to help figure it out. Because when we are in positions that we can figure things out, and when I say figure it out, not in a vacuum, not by ourselves. working with individuals who have all been impacted by these social determinants of work. It's our collective responsibility to solve for those. So I'm going to have a PowerPoint presentation put in this link, or a link will be provided so that you can click on it and find out a little bit more information. And then I will also then put in some information so that you can contact and read more about Dr. Angela Jackson. These are not my words, these are hers. And so I want to ensure that you check out her information, but realize that we collectively have a lot to do, and it really is important for us to do this work. So thank you for the time, and I look forward to us moving and having a discussion about social determinants of work. Thank you.